Hello and welcome to the Newly Diagnosed webinar series. In this session, we will be talking about dietary management for inflammatory bowel disease. Within this session, we will be talking about the dietary management options that can help control your symptoms related to your IBD. IBD cannot be cured or prevented with diet, and it is very individualized. Some individuals may restrict certain elements of their diet, whereas others can eat anything they want. So it really is a trial and error to know how your body responds to different foods. So we'll be talking specifically about diet within this webinar. We'll be talking about general diet recommendations, making mention of some experimental diets, and then talking about diet considerations when you're in a flare-up or when your disease is active. Generally, you are able to eat foods within all food groups. And when your disease is inactive, there really is no limitation. However, some individuals may avoid trigger foods that are individualized to them. So what are trigger foods? Trigger foods are individual to you that make your GI symptoms worse. So you may experience abdominal pain, bloating, gas, diarrhea after eating certain foods. And so you might want to avoid those foods because it makes you feel uncomfortable and unwell. And so you might choose to avoid certain foods. Common trigger foods can be things such as chocolate, caffeine, things like alcohol, spicy foods, greasy foods, simple sugars, and dairy products. A lot of individuals who have IBD are lactose intolerant because they get those GI symptoms. So you may, over time, you will learn what your trigger foods are, and you may choose to avoid them. But there really is no restriction for diet related to IBD. Some dietary supplementation may be required, and certainly a multivitamin will help with that risk of malnutrition, because when your disease is active, you may not absorb all of the nutrients that you should be from the foods that you're eating. When your disease is active, you feel unwell. You might feel nauseated, sick to your stomach. You might have abdominal pain, and you just don't feel like eating, frankly. And so some dietary, multivitamin supplementation can help so that you can absorb those nutrients. If you are lactose intolerant or are limiting the amount of milk products you take in, you may want to include a calcium supplement within your diet. And along with that is vitamin D. Vitamin D helps to absorb that calcium within the body, but it also has anti-inflammatory properties as well. So you may want to talk with a dietitian or your healthcare provider about vitamin D supplementation. That vitamin D and calcium supplementation is important to help support your bone strength. And so for individuals who are on medications such as steroids for over a long period of time, steroids can pull that calcium out of your bones and make your bones weaker. So you may want to consider supplementation if you are on prednisone. If you've had surgery, particularly in your small intestine, you may need vitamin B12 supplementation. So vitamin B12 helps form red blood cells. And if part of your small intestine is removed, your body may not be able to do that, or it may have trouble. So you might need B12 supplementation in pill form or injection form. Your healthcare provider can monitor these vitamin and mineral levels so that you can see if you are deficient and see if there is, if they do recommend supplementation. In terms of other diet recommendations, You may have heard the term probiotics. Probiotics help with digestion, and they can decrease inflammation for certain individuals. So they promote the growth and development of that microbiome. And that microbiome is a collection of microorganisms that are in your digestive system that help with digestion. Probiotics have been shown to help for individuals who have had surgery for ulcerative colitis, and it can decrease inflammation after that surgery. So probiotics help promote good gut bacteria growth. Other supplements that may be considered are the omega-3 fatty acids. So these are cold water fatty fish such as salmon, tuna, trout, sardines. They can be found in various oils like canola, walnut, and fish oils, or ground flaxseed. And these help to decrease inflammation as well. There are other experimental diets that are currently being researched, and many diets have been shown to improve symptoms, those GI symptoms, but none have been proven effective to treat that inflammation or to treat that inflammatory bowel disease. And we do not recommend you follow these diets on your own. Certainly use the guidance of a dietitian to help you. And I cannot speak highly enough about the role of dietitians in inflammatory bowel disease. So if you have any questions regarding diets, please access a dietitian in your area to talk more about supplementation. In terms of the experimental diets on the screen there are 4 that are listed. I'm not going to go through them individually because you can, read them for yourself. But with these diets, they are quite restrictive. So they exclude certain foods and food groups, and with the hope that it will decrease symptoms and ultimately, hopefully, decrease that inflammation. But again, these diets have not been shown to be effective in treating that inflammation or treating that inflammatory bowel disease. But these can be quite restrictive diets. So again, use only under the guidance of a dietitian and making sure that you're monitoring your nutritional status as well through blood work. For those of you that are experiencing a flare-up of your IBD and not able to take a lot of food in, I just wanted to add this slide here because it tells you, gives you some suggestions. Because when you don't feel like eating, what should you be taking in? So if you know what your trigger foods are, you can avoid them. So that'll manage your symptoms a bit. And eat safe foods. So what are safe foods, you ask? Safe foods are things that are easy to digest and do not bother your digestive system as much. So examples of safe foods include white rice, white bread, bananas, applesauce, turkey, chicken, fish. So those are quite gentle on your digestive system. Also recommend eating smaller meals more frequently. So don't have 3 large meals throughout the day. Have, maybe 5 or 6 meals throughout the day, smaller. If you're experiencing some diarrhea, you might want to choose foods that thicken up your stool. And stool thickening foods can include cheese, peanut butter, Jell-O, pretzels, or chips. It's recommended to include a protein with each meal or snack. So proteins, examples of those are meats, poultry, fish, beans, peas, lentils, eggs, and dairy. That will help maintain your strength and your muscle mass. Keep hydrated. And that's easier said than done when you are having 30 diarrhea stools a day. But do the best you can. So drink at least 2 liters of water if you are able. You might even want to integrate some electrolyte replacement drinks. So things like Gatorade or Pediasure, something that has some electrolytes within it. Limit your alcohol and caffeine intake because these drinks can be very dehydrating. If you really cannot take a lot of food, solid food in, you can take in high-calorie liquid formulas such as Boost or Ensure. They have the nutrients that you need. I recommend them cold. You can even mix them in a blender with a banana or yogurt, some ice. They're a little bit more palatable when they are cold. And if things are really not going well for you, you can be admitted potentially to hospital or as an outpatient and have intravenous nutrition therapy if things if you've lost a significant amount of weight. So that is also an option as well. But in terms of diet, it really is, you know, a trial and error as to what works well for you and what doesn't. And this in itself can be quite frustrating as well as you learn to know what works well for you and what doesn't. So this ends our session on dietary management. Please feel free to visit the other sessions as well.